Hi, this video is the art of hair transplant restoration surgery on a client with a receding hairline and corner. And basically, our goal is not only to lower the hairline, but bring in the temple as well. For this client, we just lower the hairline, we'll bring it without bringing the temple. You're gonna have a low hairline with a wide forehead. So the hair transplant, the surgical skill will depend of the surgeon will depend will predict the density. The artistic and aesthetic detail is very important to create a natural hairline. Having hair transplant, not like the old days. The old days you should be happy just to have a hair. But nowadays having hair transplant, is not good enough. You wanna have a most natural hairline that you wanna walk down the street without much detectability. And that's required the artistic and aesthetic detail. On average, from the mid-eyebrow to the hairline for Asian and and black is around 6.5 to 7 centimeter, and for Caucasian is around 7.5 to 8.5 centimeter. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. No hairline straight. I mean, we draw this as a median, but the real hairline is an imaginary line. We zigzag through. Now, we have two type of hairline, and there's one what you call a tight hairline versus a soft hairline. The soft hairline has bigger zigzag, and it looks very natural. However, because it's such a bigger zigzag, I mean, we use a lot more of the root that grows single hair. That means it looks a little bit thinner in an appearance versus a tighter hairline. Tighter hairline, we use a smaller zigzag, and with a smaller zigzag, there's the right behind it right away you have thicker root, 2 hair, 3 hair right there. So then it will looks very sharp and very dense because there's a less of the single hair roots in the front, but there's a lot of root that grow 2, 3 hair right behind it. Now sometimes some patient afraid that it looks a little bit artificial. Again, when I create the hairline, I don't create the straight hairline. That's look too artificial. So it depends on the personality, really. You're not gonna go wrong with either one. Celebrity like sharp hairline because they want a wow look, and some people personality is they don't want to be aggressive, they don't want no detectability, then they want a soft hairline. Or and the more popular one is somewhere in between, so you don't have to go tight hairline or soft hairline. So somewhere in between is fine. As you can see, if you can turn this way, you see his temple has gone back. It's like a crescent shape. So I'll go to bring it back and still point it backward. And if you can turn this way, it's the same thing. See? And the most important thing is you want to make sure it's proportional overall. From the mid eyebrow to the hairline is a third. From the mid glabella to the tip of the nose, the third. Tip of the nose, bottom of the chin is a third. For the midpoint to the side, on average is 7 to 8.5 centimeter. Rarely 9 centimeter, but this one is almost 10, so it's too wide. So I do a lot of precise measurement from the mid eyebrow to the hairline, from the midpoint to the temple as well. We'll be attempting at least 2,500 grafts to give the full density. I'm very excited for this client because in a year time he will look completely different. Once you have a lower set of hairline and full set of hair, it will enhance your eyes, your nose, and all the features that God created. It bring back your look, and on top of it, it bring back your youth. And with my work, it'd be very natural and very dense. And again, hair transplant is not a perfect science. Sometimes you're gonna need more than one surgery to have perfect density. Depending on your personality as well. For more information, you can go to my website at www.mhtaclinic.com or call 1-866-999-6482 or 408-356-8600. Thank you.